Good evening, everyone. It's 6 o'clock. I'd like to call the Community Mental Health Full Board Meeting to order, and I'll begin by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next is adoption of the agenda.
Motion to adopt.
Support.
Motion by Phillips, support by O'Connell. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? The adoption of the agenda has been adopted. Next is hearing of the public. Is there anyone from the public that would like to address this board? You have 5 minutes to speak. And please identify yourself and your home or business address. Anyone want to address the board? Seeing none, we'll move on to the minutes. Item number 5, the minutes of the regular meeting of the board that was held on August 28 of 2019.
Support.
Motion by Bush,
Support.
support by O'Connell. Any discussion on the minutes? All in favor signify by saying aye.
Aye.
Opposed? The minutes are approved. Next is item number 6, approval of the standing committee meeting minutes from program and budget meeting held on September 11 of 2019.
Support.
Motion by Fantuzzi,
Support.
supported by Phillips. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? Those minutes are passed. Next is item number 7, and that's the request to approve. There are 3 requests that were carried over from our program and budget meeting.
Madam Chair, I'll make a motion to approve items 7A, B, and C.
Motion by Kraft to approve motion 7, items 7A, B, and C.
Support.
Support by O'Connell. Any discussion? All in favor signify by saying aye.
Aye.
All opposed? Motion carries. Next is item number 8. Are there any items that need to be received and filed? Nothing came in? All right. And were there any, item number 9, any resolutions? None. And then item number 10, probably one of our most, not one of the, one of the most important, is to approve the payment of the bills.
So moved.
Motion by Bush, supported by Plua. Any discussion on the bills? All in favor signify by saying aye.
Aye.
Opposed? Motion carried. Next is item number 11, the management report.
Good evening. At the Program and Budget Committee, when the item came up about the out-of-state travel for the veteran navigators, I believe, Linda, you asked for an update on that program. So this evening we have Nicole Gauthier, who is prepared to give us an update.
Great.
Yep, like I said, I'm a Marine Corps veteran. I've been in this position for almost a year. I think it was the middle of October that I started here. Prior to being in Macomb County, I was the veteran navigator in Lapeer County for 2 years. I really enjoyed doing this, passionate about serving, working with veterans and military families. I've been doing that in some capacity since 2014 after I graduated with my master's in social work from Wayne State University. So there's only about 6,600 veterans in Lapeer County as opposed to between 60 and 70,000 here. So I'm very busy. Actually, just the past 5 hours I've gotten 5 new referrals, so I keep very busy. So the unique thing about the Navigator program, just to make this brief, is it doesn't matter what era the veteran served in, doesn't matter what their discharge status is, we can work with them and their family members. So I do a lot of linking and coordinating of resources, crisis intervention, advocacy. I work closely with our Macomb County Veterans Services Office, the Veterans Courts, the VA Hospital, the Vet Center off of Garfield, which services veterans who've been in combat or experienced military sexual trauma. The Navigators were brought on a couple years ago to fill in gaps for veterans that were being underserved in regards to mental health and substance abuse. Also, Michigan being primarily a Guard and Reserve state, many of them are not able to utilize the VA because you have to have served so much time active duty to go to the VA, which a lot of our hospitals don't know. So that's part of my job also, to go out and educate Havenwick, St. John Maross, Harbor Oaks, McLaren, Macomb, all of the hospitals that we work with in our PIHP. I meet with veterans in the Macomb County Jail to see what they might need assistance with when they get out. I get referrals on many different things, whether it be mental health, housing, substance abuse, legal stuff. I'm kind of the center person in regards to veteran and military family resources in the county. I work closely with the Access Center also, and Open Access, and our contract providers. And since coming into this position, I work closely with the Wayne and Oakland County Navigators. We do a lot of events and outreach together and educating the hospitals that we all serve. Also the VCATs, which are the Veteran Community Action Teams. Work closely with the VSOs, which are the Veteran Service Officers that help the veterans get their different benefits, whether it be medical disability for service connection from something that happened to them, or education benefits, excuse me, veterans that have passed away, helping their families get their death benefits. Like I said, I do a lot of coordinating of care, referrals, linking with the PIHP, educating. I am mental health first aid trained. I got trained earlier, so I just taught recently my second class, and I will be able to go now online and do the module for veterans and go out with the other navigators and teach individuals in the community that work with veterans that veteran component of mental health first aid, which is why I got that training earlier this year. And I also do help out CMH to teach classes when they need assistance with that. The Veteran Navigator Program also started a really good program underneath our umbrella of navigators this year, which is very well needed, is a female veteran peer support group. And that isn't a support group in the sense that they're sitting around talking about what they did in the military and their feelings and stuff like that. They're doing equine therapy, mixed martial arts, things like that to kind of get out and rebuild the camaraderie. There's a lot of female veterans and veterans in general that are unidentified or don't identify themselves as veterans. So now we're trying to ask the individuals, I'm educating the individuals at CMH that I work with and everyone out in the community I come in contact with to ask if the individual has served in the military, not if they are a veteran. Because somebody might have served in an era that wasn't combat, they might not have deployed, they just might not consider themselves a veteran, but they are. So that's something very important too. And the reason I am going to Utah is to help individual Brian Webb and the other navigators. We're going to be starting a recreational therapy program next year in the spring that's going to be underneath the Veteran Navigator Program. So us and Texas are the only states that have this program so far to this extent. So we based this off of that one in Texas. It's very much needed, though, because, like I said, a lot of veterans can't use the VA. Maybe they had a bad experience. They don't want to go back. So I kind of, I can rebuild that relationship, too, to help them go back there. I already said all this. Are there any questions? And I have a PowerPoint that I can email out for you all to look at. That's just the information that I discussed.
Yes, thank you for explaining that to us. And yeah, if you could just forward it to Dave, and he'll
Definitely.
make sure it gets passed on to all of us. It'd be
Yes.
good to see. I have a question about, I think I know the answer, but I just wanted to ask it so other people can know. You'd mentioned that some people have to be they have to be part of I forgot what it's called, but an event, not an event, but they don't always qualify for some of veteran services because they did not serve during a conflict.
Well, some of the individuals here have only served in Michigan in the Reserve or the National Guard, which means they're not eligible for VA health care. But if they did a deployment and they were injured, then they can get a service connection disability. It's kind of like the equivalent of Social Security, but it's disability through the VA. And that's the thing, it's, some veterans can qualify for housing assistance, some can't. There's just a lot of loopholes. It's a lot to explain right here.
Sure, but I guess one thing that, from listening to you talk, for all of the rest of us, is if somebody spent one day in the military, there's probably something that you can connect them to if they need the assistance. Is that correct?
Yes.
Yes.
They're
Yeah.
eligible for a lot less, unfortunately, but I can help them, but like I said, they probably can't get any services through the VA for that time period.
And perhaps people are directing that family, saying, well, try the VA, and that's not working, so they think they don't qualify for anything, but you will help them find the help that they need somewhere.
Yes, whether it's through Medicare, Medicaid, there's also an awesome organization called Give an Hour, where individuals who are licensed therapists, counselors, psychologists get vetted, and there's a website where people have pledged to give an hour of free therapy through their practice to veterans and first responders. So that's something I sometimes have to use too, because we know transportation is a huge barrier for individuals out here, especially in northern Macomb County.
Thank you. Are there any other questions? Linda?
Thank you for inviting her. Thank you for what you do. I really appreciate this report. Do you have money, or is there still like the Veterans Trust Fund where if people need financial assistance, they can
Yes,
get it?
at the Verkulen building where the Macomb Veteran Services office is, that's where they handle the meetings. I believe it's twice a month where the veterans can apply for the trust fund. Like I said, I work closely with them, and I call them probably on a daily basis for, I have a veteran that might need help with, a number of things. But they do have the trust fund. There's two different ones, though. One of them you have to have served during combat, and the other one you haven't. And they can approve to help veterans with assistance if they're possibly facing eviction, if they maybe need assistance with a car repair, a number of things.
And I just want to say your passion and dedication
Yeah.
is real apparent, so.
Thank you
we're
for
lucky to
having me.
have you, yeah, thanks.
Anyone else? Yes, Dana?
Thank you. How many veteran navigators do we have?
We have 17 throughout the state. So it goes by the region. So there are some county navigators because there aren't as many veterans in those counties. Like, for instance, where I came from in Lapeer, there's about 6,600 veterans. So I can email that out to Dave too, if that's helpful, the list of all the navigators. Yeah, there's one that covers the whole UP, and like I said, there's not one for every single county, but because of the, up north, the rural areas. But
Do they give these out at Veterans Court so people have this information?
they should have it.
I'm just curious.
Yeah, and I worked very hard to build a relationship with the Macomb County Jail too. I participated in their crisis intervention training a few months ago, and they had a certain amount of officers off of the road that we all from CMH, a lot of us helped teach that. So when a veteran comes in the jail now, more often than not, when they go through classification, if they identify as a veteran, I'm getting that referral instead of them sitting in the jail for a long time and us not even knowing that they're there.
And I just want to echo what Linda said. I being new to the board, there's so many things I don't know about. I had no idea we had this. And I just want to thank you for what you do. It sounds like a wonderful program, and you can tell you're very passionate about helping people, so
Thank you.
Yes.
This is community mental health, we voted on this last year. There's also a millage in Macomb County, and that's a veterans office or?
Macomb County Veteran Services, yes, so.
Okay. And do you
they-
work with them? Is
I
there-
work closely with them, not obviously for them, but.
Sure.
They have
sure.
the Veteran
I just want to
Service.
make that distinction that.
Yes.
You are mental
I work
health,
for
yes.
community mental health, yes. So yeah, they have the service officers that help veterans get whatever benefits that they deserve through the VA.
Just illustration of the work that is being done. I know someone who sits on the Veterans Service Trust Fund. That's one of them that gives out money to people who need it, who have served in a conflict. And the person was just describing some circumstances that were just, it was very hard for, they wanted to help, but they didn't have enough resources, or their, what they do is limited in what they can do and what qualifies. And then I said, well, it sounds like they need the veteran navigator to help out. So a phone call was made. Nicole had already been involved and was helping with them because there was some depression issues along with it, which is why there was some financial issues. But Nicole was already she was on it. So that was yeah, that was good to hear.
Yeah, thank you.
Yep. Thank you very much.
Thank you, Nicole. I learned more too. Yeah, we provide so many services. It's pretty much you can learn something every day almost. Lots has happened since we met last time. I pulled together an internal group, including Jim Losey, who he had worked diligently in the past with Macomb County CMH about becoming a CCBHC, which is a Certified Community Behavioral Health Center. It's part of the Excellence in Mental Health Care Act put forth by Senator Stabenow. The intent of that meeting was to see what parts of that model we could use as to help us move forward. It focuses very much on integrated health care, and I thought it would be a good model. Apparently, I was about a week ahead of the curve. I got an email from the State Department, and there's legislation at the federal level to add additional states to the CCBHC program. So there's a chance of some additional sites being added, and they were reaching out to the areas, entities that had worked on it previously to see whether or not we're still interested. So far, one region has said yes, one region has said no, and we're looking at that again to see if we think we're in a position to move forward with that formally. So I'll keep you posted. In your packet, there's the article, the Cranes article, that describes some of the what's going on with the budget talks in Lansing. Pretty much the Medicaid health plans snuck some language into the budget proposal that would act in their favor. It would allow them to bypass the current public system of the PIHPs and CMHSPs and contract with providers directly in those, the 298 pilot regions. So that was a big one. We kind of knew that's what they wanted. They're on record saying that that's in their favor. So the Community Mental Health Association of Michigan, Bob Sheehan, who you see pictured there, they came out against it. They're asking Governor Whitmer to veto those sections, and you can read the detail in the article. Also in your packet, there's a handout labeled Open Beds. Macomb County was selected, and we're the first county in Michigan to pilot the Open Bed program. It's a software package purchased by the state of Michigan. It's in, they've had, it was MyPad, and now it's MIPSIP. It's the looking at the inpatient psychiatric beds and how to best access those. and they're talking about all the problems about people finding an appropriate inpatient psych bed, sitting in the emergency rooms too long, and things like that. Part of the recommendations was for a psychiatric bed registry. Doesn't cure all the problems, doesn't fix hardly any of the problems, but it's a start. So they would have the bed registry statewide, and it would help our screening teams and the local hospital emergency departments focus and locate which hospitals had an available bed. And pretty much it'll just say, yes, I have a bed, and it might be a male or female bed. The hospitals will still have the ability to review the screening packet and make those determinations, but it's a step in that direction. They've expanded it for us too. We'll be able to load pretty much our entire provider system into open beds. So people would be able to find an appropriate adult foster care home bed that was open, or some of the other services. I'm looking at Adam, see if I missed anything from the meeting. So we are the first. We've had one planning meeting. John Villacerda is leading it from the Michigan Department of Health and Human Services, and we'll be moving forward and keeping you posted. On Monday, it's kind of timely. I did present to the Board of Commissioners on, as a follow-up to a meeting we had about the financial audits, and they had requested additional information. So on Monday morning, we got our final version of our Medicaid capitation rates for next fiscal year. So on September the 23rd, we received the rates that go into effect on October 1st. You can see the timelines there. We've already signed the contract for next year without knowing those rates. We've already submitted a budget through this body and to the Board of Commissioners that was a projection based on this year's revenue. So we might have to make some adjustments. Also today, the Board Association did some rough math, and for Macomb County, looks like our annual revenue combined would be about $218 million, which is about an $18 million increase from this year. In there, though, was the Children's Waiver Program, which previously had been a direct bill, a fee-for-service. They rolled that into our capitation. That's about 3.6 million out of that 18 of the increase. There was a 5.75% increase specific to the autism services that was intended to help the prevalence. So they set the fee schedule for autism, but they gave us more money so that we can treat more people. So that's good news. We'll be looking and following up on that detail as well. Hopefully you saw the emails that went out about Robert Gordon is available to tour Macomb County. Lynn was kind enough to help. She was voluntold, I guess. She's helping us coordinate that. We will try to schedule a planning meeting. Off the cuff, we're looking at, making sure that this board is invited, notifying the Board of Commissioners, especially their Health and Human Services Committee. And Monday, when I presented to the Board of Commissioners, didn't quite realize, I didn't read all the other agenda items. I was focused on me. It was Legislative Day, and the entire Macomb County delegation was present Monday at the Board of Commissioners meeting, and they all spoke before me. So my presentation went really well. The whole evening, whole afternoon went well. A number of the legislators were very favorable to our plight here on the community mental health side, spoke favorably. Yeah, so, and I got to meet a number of them personally or meet them again, so it was very helpful. So we will follow up with Bob Gordon's visit, plan a brief tour, and we're planning on a full day for that event. I also sent out an email earlier today that tomorrow at 8 a.m. on Fox 2, our own Terry Nakugar, who is the supervisor of Children's Services, is presenting. It will be interviewed along with a parent support partner, and I'm sorry, I don't have the name of the parent support partner. Does anybody there know? No? So we can learn who that is tomorrow morning at 8 a.m. Going back to the Board of Commissioners, there will be some follow-up. Phil saved me. I did a presentation about the audit findings and the steps that we've taken. Pretty much we've had repeated citations of material findings from the Plant Moran audits related to the number of adjustments that need to be made and that are made after October, after the end of the fiscal year, and the length of time that it takes us to close a fiscal year. So we've instituted the 60-day claims edit. So providers have 60 days from the date of service to get their clean claim into our system. That's going well. We're working out the wrinkles, and we're looking at working with Raymond, who this board approved that contract. We do need to go back to the Board of Commissioners in a formal way to ask for the financial assistance for that contract. So the groundwork was laid before and then on Monday afternoon, and I'll work with Phil to take that forward. And we're also working, we're in discussion with Plant Moran. They made an offer when we met with them and members of the audit committee of the Board of Commissioners to help us out, pretty much get on the same page as the rest of Macomb County. We're in discussions with them right now to see what they have to offer. There will be a call with them before I leave on vacation. And to end on a high note, I will be leaving on vacation. Going to Italy, thanks to you all, for the first time ever. I'll be off Friday, October the 4th, and then I'm off the entire next week. The following week, Monday, is a holiday, Columbus Day. That's October the 14th, and I will be returning on October the 21st. So it's the 10 work days off. And Adam has volunteered. No, he volunteered to cover everything in my absence too. Yeah. You hear that, everybody? They're looking forward to those changes. Yeah, so I will be off the grid for a little bit, but when I get back around, and I have zero concerns about leaving the agency and with the staff that are in place. So, thank you. Oh, I'm sorry, I do have other updates. We have the Crossroads Clubhouse. I was planning to go to their Oktoberfest celebration, then it says root beer. So, I had my hopes up momentarily. But that is the 26th annual open house for our Crossroads Clubhouse. It's October the 2nd from 2 to 7 p.m. They do some really good work there at the clubhouse, so if you can make it, I do strongly recommend or suggest you go. And then for your calendars, we have a recipient rights advisory, and is that confirmed now for Thursday, October the 3rd, and that's the early meeting at 7:30 a.m. at the administrative offices. There's a recipient rights appeal committee, which is Tuesday, October the 8th, again at 7:30 a.m. at the.
That's new, right? We don't know that.
Oh, is that the one that's confirmed too, or?
Yeah, that's confirmed. That's good.
Okay. So October the 8th, Tuesday, 7:30 in the morning. The October program and budget, which I will miss, is Wednesday, October the 9th in this room. And the full board meeting, which I will be back for, is Wednesday, October 23rd at 6 p.m. Barb has been trying to work with the metro region, specifically Wayne County, because it's their turn to host. We have a tentative date of December the 12th at 6 p.m. for the metro region dinner. December, yeah, so kind of they've moved the quarterly out a little bit. Apparently, that's a tentative date, and they might have to push it back until after the holidays, depending on the outcome of another meeting this afternoon. So hopefully we'll know this week and be able to confirm that date and where it will be held, because we don't know where it will be at either. So stay tuned for those updates. Thank you.
Okay, I have a question regarding the billings, the 60-day billing. Is that caught up now? In other words, probably that was put in the contract, I don't know what they call it, but anyway, where they have to go and look and find out. So has that caught up now, so everyone should be 60 days, or are there still some out there?
We met with finance, Adam and I did, and there was a couple unique cases that had come up. Most of those have been resolved. I got an email today from a provider that we still need to settle on, but it was very minor. It was less than $2,000 in claims. Oh, and it was, theirs was related to the direct care wage increase that had gone through, and they billed the improper amount. And when they went to bill the proper amount, they were outside of the 60-day window.
Okay.
So most have been resolved, and it's definitely getting better.
So, but anyone that's starting work now has to turn it in within 60 days.
Yes.
And about how many are still out there, dollar-wise or percentage-wise, that are past over 60 days?
Oh, less than 5% for sure, less than, yeah, it's a
Okay.
very small amount.
Great, all right, thank you.
Yep.
Linda?
I have a real interest in the task force for the authority not going on and on. So we don't have another date. So can you set that before you leave, or can we do it in Italy, or?
Yes, you can join me.
Yeah, our last one was canceled last week, and
No,
so
it was canceled.
I don't like the
I'm trying
disruption of the.
Right. I'm
Okay.
trying to schedule Richard Carpenter to present at that meeting, or Kevin Evans, who's the director of the Martha T. Berry Center. I wasn't able to get either in September. I'm playing phone tag. Kevin's executive assistant was out until tomorrow, and her ask was that I go through her to schedule that. So I'll call her tomorrow and see if I can get a date in October and then get that out before I leave. Thank you.
Thank you again for the report. It's plural. And number 12, the other agenda items from anyone else. Nick?
Thank you, Madam Chair. Just a couple of things, some of which David's touched on and I want to expound upon. But just to give you an update, as you know, we've been still working on trying to get a supplemental appropriation for this year. That was not included in the budget. Kathy and I wrote, and you should all have received a copy of this, emailed to the governor and all the Macomb legislators, asking them to support one with a change in how it's distributed, as we've discussed before. And we asked members to send something similar to the governor and to your own senator and representative, if you will. there's nothing in the Constitution that prohibits the legislature from adopting a supplemental appropriation after September 30th, which is Monday and the end of the fiscal year. The only prohibition in the Constitution is supplementing the existing budget until after the budget is adopted. And it may make some sense as we go on, and we'll have further discussions on this, to trying to see if we can roll some additional money into the budget, but we did get an increase in the budget, as David indicated. On 298, David and I have been blowing up the telephone lines and our emails, so most of this I think you've gotten. As you know, as David pointed out, the the conference committee language on 298 added some very bad provisions from our perspective. I'll go into some of that in a minute. The legislature, both houses of the legislature, adopted the conference committee yesterday. In the Senate by a vote of 24 to 14, and in the House by a vote of 64 to 44. Keep in mind that whether a person voted for or against the conference report, they weren't voting necessarily just on this provision, which is a problematic provision because that's part of the whole budget for the Department of Health and Human Services, and conference committee reports are not amendable, so it's either a yes or a no on the whole thing. So while I would have preferred they'd have voted no and send it back to a second conference, I can't be too critical of those who wanted to get the bill to the governor, and the governor is looking at these bills for the possibility of vetoes. The provisions in the bill that we're most concerned about include a provision that allows the health plans to contract for behavioral health issues with other than the CMHSP. It requires the department to issue a report as to how to take this thing statewide even before the pilots are completed, which is obviously problematic. And it provides that any savings, assuming there are savings, go back to that HMO and not to the mental health system in total. As David mentioned, the State Association has asked for a partial veto of that line, or that section. There's some question going on as to whether she can do it parts or all. I sent an email and I copied it all to you on my own behalf, asking for a veto of the whole section. The Mental Health Association in Michigan has also sent an email asking for a veto of all or part, and they basically said do it either way, whatever works for you, and specifically cited the provisions I've just indicated, plus a provision that deals with MHPs retaining all functions related to their accreditation, which has some complicated provisions in it. And I think that's the only one they mentioned that weren't mentioned in either my email, which you should have received a copy of, or the copy that you received from the State Association, which I believe was copied to everyone as well. Other folks, please feel free. In fact, it's encouraged that you write to the governor, either by email or by phone call. I wouldn't do it by letter because she has to sign the budget bill and she can only line item veto when she does the signing of the full budget bill. And if she doesn't sign the full budget bill by September 30th, there's a whole lot of other problems. So, yeah, it's Monday's the day, and she may even, it hasn't been presented to her yet, or at least hasn't been presented as of now, but she'll probably get the bill from the legislature tomorrow or Friday. Under the Constitution, she has 14 days to sign her veto, but in reality, for all intents and purposes, because of the end of the fiscal year, she has until Monday to sign her veto. I would anticipate that she will sign the bill but veto portions of it, and I would urge you to communicate with the governor's office either by email or by phone call asking that she veto Section 298. The last thing I wanted to mention is that for these reasons and others, we need to have another legislative and political, legislation and policy committee meeting. If people want to talk about possible dates now, I'll leave that to the chair. I'd like to do it as soon as possible. And I know that's tough on people, but the fact of the matter is things are moving very quickly. So whenever people are available for a 7:30 a.m. meeting, I know I could make it Friday or Tuesday, Wednesday, or Thursday of next week. If it has to be later than that, it's a matter of when people are available.
Let's try right now to set a date so what was your first date?
Friday.
Hey, not everyone, the committee,
I have the list in front of me. I think Barbara probably has.
yeah,
There's seven of the,
Is Nick
7 of the
Materno,
12 of
Bush,
us.
Megan, Ryan, Dana, Bill, and Kathy.
okay, so we're all here except Megan. So let's try to set a date now. Anyone, of course, anyone on this committee is welcome to attend the meeting, but we need to make sure those who are on the committee can
We
be
need a
there.
quorum of the committee.
We do. So what was your first date?
Friday is fine with me. Friday, Tuesday, Wednesday, or Thursday.
Friday, the 27th?
Yeah,
You don't have enough time.
Or October?
Oh, October?
September 27th.
Oh, that's this Friday.
This Friday, or Tuesday, Wednesday, and Thursday of next week.
We can't have it that soon, can we?
Pardon me?
Don't you have to have 7 days to send out an agenda?
7 days? I thought you needed 18 hours.
Well, by close meeting act, the Open Meetings Act gives you you can call a special meeting with 18-hour notice, so. It's Friday? Is that, how about anyone can't do it on Friday? This Friday, the 27th. All right, what was your next one?
I can do it.
Right, let's just,
I can do Friday too.
okay, so can I. So,
Yeah. Well, that's good, because that way, if we want something to go out, it can go out immediately to the governor, if we want to say something in particular.
Phil, you can too? I didn't hear if you, yeah, okay, good. All right, so Friday, September 27, 7:30 a.m. at the Administration Building, and if the room's not available, we'll meet in the hallway or
That
something.
takes 18 hours notice, Barb, so you got to put the notice out first thing in the morning.
Send it by email because they won't get us.
Right.
I'll text Megan so she knows.
Okay. All right, anything else, Nick? Was that the end of your report, to set the date? Nick,
Pardon
you
me?
done with your
Yeah.
section? All right. Anyone else? Any other agenda items? Okay, then we'll move on to item number 13, hearing of the public. Is there anyone from the public that would like to address this body? You have 5 minutes to speak and pass out your goodies.
Good evening, everyone. So, right to begin with, I'm Sean McGregor. I'm with CEO. Just here for the annual report, or I should say monthly. What I'm handing around is just a copy of the report, basically, if you guys are interested in that. I'd like to start off with, too, that our mission statement is we believe that all people are entitled to respect, dignity, independence, community integration, and the opportunity to make choices in their own future. For our individual served update, CO continues to increase opportunities to engage in greater community, to embrace the home and community-based services final rule. Our individual served monthly educational seminar was on choking safety. For our community center update at our Clinton Township location, they've had 10 new people start. They have been enjoying the greater community by attending cider mills, Belle Isle, local parks, creative academies, and movies. The program continues to support the persons served by volunteering at local churches and parks, A community volunteer has installed over 5,000 square feet of new hardwood flooring at the building. The sidewalks and parking lots have also been repaired to ensure accessibility. At our Anchorville location, we've had 8 new persons served started in the past month. In the greater community, they have been attending creative academies, Troy Historical Museum, and had an ice cream social. The program has received a new 90-gallon fish tank, which is being enjoyed. And then as well, I've been working with one of our individuals for a micro business for Halloween pens, which I have for anyone. At our Mount Clemens location, they have created a reading and relaxation area and had 2 new persons served started in the past month. The persons served have delivered over 72 meals on wheels. The program has also received a new 55-gallon fish tank. At our Washington location, they have had 5 new persons started in the past month. They also received a $1,000 donation from Knights of Columbus. This will be used to support home and community-based services. The program volunteered for Meals on Wheels and delivered over 128 meals in the past month. The micro business for On Cloud Design sold 5 items. The Snowsland room was completed and the ladies' room was painted. For our stakeholder update, CEO Anchorville will be hosting the vendor show on October 11th from 5 to 8. There will be several vendors selling a variety of items, and persons served will be selling micro business items such as I hand out every month. This is a fundraiser to support home and community-based services, and the vendors each pay for the cost of the table and space. There is no cost to attend, but there will be raffles, and I do have a flyer. For our Clinton Township location, they're having a fundraiser for Chipotle on October 1st from 4 to 8. Please take a copy of the flyer I'm about to hand out into the restaurant when purchasing food, and they'll give you 33% of the sales back to CEO for the autism program. And then also at our Clinton Township location, they're still hosting the Kitchen Essentials baskets. Tickets are $1 for 6 or for 5. Tickets are $1 or 6 for 5. The funds raised will pay for entrance to the DNR Michigan outdoor place. CEO application for car resurvey has been received, and they will notify us about 30 days prior to the survey with exact dates. Our current accreditation and community services will expire January of 20. And then to close, CEO employees retention rate for August was 97%. Thank you.
Thank you, Sean. Is there anyone else from the public that would like to address this board? Anyone else? Seeing none, we will move on to item number 14, which is adjournment.
So moved.
Motion and support to adjourn. All in favor signify by saying aye. Opposed? This meeting is
It's
adjourned.
my favorite motion.
Thank you.